Anytime, Brad.
Oh, sorry.
Well, good morning, everyone. It's great to be here at the Homebush Vaccination Centre, joined today by Dr. Kerry Chan, our Chief Health Officer here in New South Wales, the Health Minister, Brad Hazzard, and our Customer Service Minister, Victor Dominello. Well, today there's some very pleasing signs right across our state, and I want to begin by thanking everybody from Sydney right around regional and remote New South Wales for the efforts that they have made. It's great to see that life is coming back, restaurants and cafes, people are out and about and doing so in a COVID-safe way. Today, we are launching from tomorrow our parents' vouchers, $250 in accommodation and tourism vouchers for parents right across New South Wales. This is testament and a tribute to all parents who have made an incredible effort over the last 2 years, particularly in circumstances of homeschooling, which we all know has been incredibly tough over this difficult period of time. And I want to thank all parents. We've said that from the outset, we'll be a government that prioritises and looks after families right across New South Wales. We want to put downward pressure on family budgets, but importantly as well, we want to support those areas and those industries that have been doing it tough. So message today is we launch these vouchers tomorrow, which will be available through your Service New South Wales app, which no doubt Minister Dominello will tell us all how to do it. But it'll be very simple, as it always is with Service New South Wales, to go out and support those businesses. Accommodation, we know, hotels have had a very difficult time over 2 years with international borders closed, with tourism down across our state and across our nation. So please go out and support those businesses and enjoy the best that New South Wales has to offer, as well as our tourism providers right across the state. So it's $250 for parents. Those vouchers will be in your Service New South Wales app from tomorrow. We do want to have a call out which the Minister will speak to as well, particularly in relation to the accommodation sector to register. We've had hundreds already register, but if you're in a hotel, a motel, please come forward through Service New South Wales and register your business, because from tomorrow we will have parents right across the state wanting to take a break, and we want to make sure that your area of accommodation is registered through Service New South Wales. I want to make the point, though, that we continue to do that in a COVID-safe way, and I think the efforts that people have made over the course of this period of time has ensured we've been in a very strong position today. But continue to wear a face mask inside as we move through this period of time. Continue to social distance. We know that many people are sitting outdoors rather than indoors and prioritising that. Those efforts have ensured that we're in a very strong position today. I want to thank people as well to make sure they continue to register on their rapid antigen test if they do have a positive case. Continue to isolate for that seven-day period. I know that's tough for many people across our state, but the inconvenience today is much, much less than it has been over the last 2 years. I'm incredibly pleased with how seamless going back to school has been. I know that's not the case for everyone. We have had positive cases with either children and teachers, but not one school is closed. There were people right across the state, commentators who said we shouldn't do this, we shouldn't go down this path. I was in contact with the Victorian Premier this morning to check in relation to how the Victorian experience has been. It's very much in line with what we've seen here in New South Wales. That is that schools have remained open. Disruption has been minimal, and it's been incredibly important because getting kids back at school was a strong focus of this government. So important for our young children to not miss that face-to-face learning, to be back in a social setting with their friends. And there were so many smiles on so many kids' faces as school returned this week. I want to thank our teachers, particularly. I know they worked very hard and there were different settings in place, and I want to thank our parents who over the course of this first 4 weeks will continue to go through that rapid antigen test with their children. Speaking of parents on the weekend, I know in certain circumstances, particularly with younger kids, that's been tough, but these are the efforts we need to continue to make to ensure that we keep our schools open in a very safe environment. But I want to thank our teachers because it could have been difficult. We always said, and we still say, that there will be bumps along the way. There will be bumps along the way as we move through this next phase with schools being open, but I'm very pleased with how it started. So obviously over the next few weeks we'll continue to monitor things as we go through, but our teachers have done a sterling job. So thank you very much on behalf of everyone across our state, particularly our parents as well, who know that you're there teaching and educating our young children. One of the keys, which has been incredibly successful in our state, has been our vaccination program. When I look at hospitalisations, which continue to trend down in New South Wales, when I look at ICU presentations, which continue to trend down across our state, from the city to the bush, that is also because of the many efforts that people have made in getting vaccinated. One of the highest vaccination rates, not just in the country, but around the world. And that effort that we've made over many, many months has ensured that we're in a very strong health position, and that strong health position leads to a strong economic position, and that's important because it keeps people in work, it keeps businesses open, and we get back to the life that we love. This is a global pandemic. There are challenges right across the world, but we should all be very, very proud of what we've achieved here in our great state. There'll be many challenges to come. This pandemic is not over, and that's why today we are launching our booster campaign. We have a booster rate here in New South Wales of around 47%, I think tick over 47%. We want to get that higher. Not for the sake of it, because we know that vaccinations and boosters have put downward pressure on our hospitalisations and ICU presentations in this state. So we're here at Homebush today. Gone are the days of the queues. Many of you would have got vaccinated at this centre here in Homebush and had to line up. Those lines are no longer here. There are opportunities to come in and get that booster shot at our 40 hubs across our state, as well as through your GP and your pharmacist. It's incredibly important we continue that effort, because the effort that every one of you has made over this period of time has kept us safe, has put downward pressure on the hospital system here in New South Wales, and I want to thank you for those efforts. But we need to continue to make that effort. So if it's been 3 months since your second dose vaccination, please make an appointment. We have walk-ins at many of our centres right across the state. There's no need to wait 5 weeks, 6 weeks for a GP appointment when you can come right to one of our 40 hubs, come in, come out, done, easy. So please make that appointment. If you have had COVID, I mean, obviously many people across our state and across our country have, within 4 to 6 weeks, you can receive that booster shot. So 4 to 6 weeks if you've had COVID, 3 months since your second dose vaccination if you haven't. Please come forward. That's our key message today. We launched that campaign. It's incredibly important that we get that rate up, just like across the country. We're all trying to do the same thing here. And we know it works, because when we look around the world, when we look at other countries who have had much greater challenges with their health system, with their ICU presentations, who've had much higher death rates, that's because they haven't had the success that we've had here in our state when it comes to vaccinations. So vaccinations and boosters work. Please go and make that appointment. We have many appointments available in all of our 40 hubs across the state. So can I thank everybody again in finishing? Can I thank everybody for the amazing efforts they've made? We should be very proud as a state of where we sit here today. The fact that we're seeing many businesses thriving, we're seeing many businesses and cafes and restaurants right across the state thriving again. There's still a long journey in front of us, but we've taken the right approach here in our state. Lockdowns are not the answer. Opening up is the answer, alongside a high vaccination rate. That's what we've done in this state, and we've done that because of the efforts that everyone has made, and that's why we just need that effort to keep going. Please go and get boosted. I'm now going to pass to Dr. Kerry Chant, who'll provide a public health update. The Customer Service Minister, Victor Dominello, will tell you how to get access to these vouchers through your Service New South Wales app, which he assures me is seamless and easy, as it has been in the past. And then Minister Hazzard will address anything that we've left out. Thanks.
Thanks, Premier. So 47.7% of the eligible population aged 18 plus have received a booster dose, and when we take the 16 plus it's 43.5%, with those 16 pluses and 16s and 17-year-olds recently being able to be eligible for a booster. It is also pleasing to see that gradually our 12 to 15-year-old first dose and second dose is inching upwards, but clearly that's sitting at 83.4% for the first dose and 78.7% for the second dose, and we would like to see that increased, particularly as schools have gone back. Our 5 to 11-year-old age group vaccination is 42.8% of children have had their first dose. And again, could I urge parents to please book the children in for vaccination, either through our hubs or through your GP or pharmacist. Overall, it is pleasing when we look at a variety of different sources of information that gives us a sense that we are slowing the spread and we are seeing a decline in transmission in the community. Now, the reasons for that are the booster is contributing to that, as well as the fact that members of the community have been infected with COVID, as well as all of those actions that you as individuals are taking, complying with those mask wearing, getting tested, isolating. These are essential complements to the booster rollout in keeping the case numbers low, and can I thank the community for their efforts. So we currently have 2,321 people in hospital, including 147 in ICU, of whom 66 are ventilated. We've seen 7,893 positive test results returned, including 4,333 positive rapid antigen tests and 3,556 positive PCR tests. Now, that 3,556 positive PCR tests were returned from around 35,697 PCR tests. So please continue to get tested, either by the PCR if you can't access rapid antigen testing. The turnaround times for our PCR have improved significantly, and we wouldn't want you to sit at home not realising that you can get that PCR testing. We also urge you to please upload your RAT positive tests, and the reason multiple. One is the data is always useful to have, but most importantly it will link you to care. And we also remind that aged care, when an aged care resident gets a positive rapid antigen test, if the aged care residents can also upload, that will also connect them to care, in addition to the role of their GP in supporting them. Sadly, today we're announcing the deaths of 28 people, 17 men and 11 women. And of the 28 people who died, 2 people were in their 40s, 3 were in their 60s, 6 people were in their 70s, 10 people were in their 80s, and 7 people were in their 90s. Can I just express my condolences to those who have lost loved ones. 3 of the people who died who were under 65, 2 women and a man. 1 person had received 3 doses of the COVID vaccine, 1 person had received 2 doses, and 1 person was not vaccinated. All 3 had serious underlying healthy conditions, and as you're aware, we give that more detailed update around deaths on that Friday presentation. Thank you.
Well, thank you, Dr. Chant. Today I'd like to give an update in relation to a number of initiatives. The first is we're going to commence our rollout of the booster campaign, in the sense of we were very successful with the people of New South Wales in getting the first and second jabs. We now need to get that booster into people's arms. We will start having that TV campaign commencing tonight. Tomorrow it will be on radio and the papers and social media, so please expect that. It will be critical that we focus on protecting ourselves, our family, our loved ones through the booster, and to make sure that we continue to keep businesses open and the economy thriving, particularly with the challenges ahead with the pandemic. The campaign will be in 19 different languages, and there will be a specific campaign for Indigenous communities. In relation to the parent and stay vouchers, about 5.1 million people in New South Wales have received their Dine and Discover vouchers. Now, when you think we have a population, an adult population of approximately 6 million people, that's about 85% of adults in New South Wales have received or accessed their Dine and Discover vouchers. They've proven to be very, very popular. And more importantly, they are so important to stimulating the economy. For every $25 voucher, about $40 is spent. That's a 60% increase on the initial $25, which is significant. And that's just the immediate spend. There's the additional periphery spend of getting a taxi or an Uber to the venue, or going to another venue to have your ice cream or a dessert or something else. So these voucher programs, that is pretty much only here in New South Wales. I don't know of any other state or territory that's doing something along the same lines through a similar app, have proven to be very successful and popular. Tomorrow we'll be launching the parent vouchers. Now, as the Premier has said, the parent vouchers will be available through your Service New South Wales app. You need to apply through your Service New South Wales app. But applying is very simple. The 85% of adults that are using the Service app, you'll get a push notification on your app saying apply here. And if you miss that, you just go to the voucher section of your app, and there'll be a big button there, apply here, press that button, a few clicks away, answer a few questions, and you'll get the vouchers on your phone within a matter of hours. For people that don't feel comfortable or confident with technology, there's always Service New South Wales there on 137788 that can help you through the process. But again, we're encouraging parents and all adults in New South Wales to take advantage of these various vouchers, because they are so good in helping to stimulate the economy, and ultimately helping in particular small businesses that have done it so really, really hard over the last few years. Now, the parent vouchers, there'll be 5 lots of 50 for every household in New South Wales that has had a child that was enrolled to school last year, and that was at some point of last year essentially homeschooling because of the pandemic. The vouchers will be available, as I said, per household, and the vouchers are stackable. That is, ideally, you've got 5 vouchers, you use them at 5 different premises, because that means you share the love, but you can stack them up, so you can have $100 voucher, 150, 200, 250 if you choose at a particular venue. The parent vouchers, as the Premier has said, will be available for the stay venues or the discover venues as part of the other suite of packages that we're bringing out. Finally, in relation to the stay vouchers, they will be available come 21 February, and I'll have more to say about that as we approach that date. Again, thank you to all the people in New South Wales that have embraced the vouchers on their phone or otherwise, because they have been very successful in helping stimulate the economy. Thank you.
I'd just like to also start off by expressing my condolences to the 28 people's families who passed away. And obviously each one of those people have families and friends, and our strongest sympathy goes to each and every one of their families and friends. It also reminds us, though, that life in a pandemic can be pretty tenuous. And what we do know, though, is that boosters can make a huge difference to actually the risks that come during the pandemic. So the question in my mind is, if we have almost 95% of people in New South Wales double dosed, and we've got about a little less than 45% of people who've had the booster, what's happened to the other 50%? Why aren't they out and about getting their boosters? Can I say to that group of people, we know the science is in, the medicine is in, the research is in, boosters make a difference. It's much less likely that you'll end up being ill. It's much less likely you'll end up in hospital, much less likely end up in ICU, and of course much less likely you'll die. So we have more than 40 facilities across New South Wales for us to be able to go and have our booster. My strong encouragement is to each and every one who is still in that missing 50% that hasn't yet had their booster, go and have it. Go and have it as soon as possible. If you don't want to come to one of our major state facilities, There's GPs, there's obviously pharmacists. There are so many opportunities for you to remove the risk of this pandemic by going and having your booster. We know life is challenging at the best of times, but when a pandemic hits you, then there are a lot more risks. Remove the risk, reduce the risk. Go and get your booster as quickly as possible. Thank you.
Questions?
Minister,
Yes.
you posed the question there. Why aren't people getting a booster? 43, 45%, whatever it is. Why the gap?
Look, we have a lot of people working on that at the moment to try and establish why people haven't actually had them. There are a number of factors, we think. One of the biggest factors is simply that people are not actually aware that they can actually have the booster. People are still locked in the old messages that occurred many months ago. That is, you've got to wait 6 months, for example, to have your booster. Well, no, as the Premier said, it's 3 months after your second shot or 4 to 6 weeks after you've had COVID. There are obviously other issues. I think to a degree people are tired, people are exhausted, and perhaps they've got other priorities. But I've got to say, I mean, normally our priorities are to get our kids to sport on Saturday morning, to go and pay the mortgage, get the groceries, but in front of all that should be go and get a booster so you can do all those other things.
Minister,
Yes, James.
rate of booster dose in New South Wales is less than that in other jurisdictions. Do you know why New South Wales residents who are eligible for their booster shot are not getting it as quickly as?
We've talked about that in probably half a dozen press conferences so far, but I'll repeat the answers that we've given before, and that is New South Wales had a lot of people become eligible a lot earlier because so many people in New South Wales heard the cry earlier on to come out and get their first shots. So they were eligible a lot earlier. The net result, though, is we have far more people who are eligible. The question now is more, well, why aren't they coming for their booster shot, which is why I just answered as I did.
Yes, James.
The Dine and Discover vouchers, using for takeaway, that was done during the Delta lockdown.
Yeah.
Can you still use them for takeaway, and should you be able to use them for takeaway?
We're working that through.
We're working that through. But I'll make this point. I want people to go out and about. Let's get out there. We've done an amazing job in this state. These vouchers are great for family budgets and they're great for businesses across New South Wales. And all our local businesses, just like right across the country, have gone through a very challenging time over the last 2 years. Our strong financial management here in New South Wales has enabled us and allowed us, as the Customer Service Minister has said, there's no other jurisdiction that's doing what we're doing here. These vouchers are great. Families love them. Parents love them. Businesses love them too. And we want people to go out and about and enjoy the best that New South Wales has to offer, and particularly to support those tourism businesses. Without international borders being open for 2 years, our tourism businesses have done it tough. And particularly in Sydney as well. It's been great to see regional New South Wales be booming over this period of time, with many people enjoying their Christmas holidays out in our regions. But we particularly feel for Sydney right now. Sydney's been doing it tough for 2 years. These vouchers, well, I don't know, for families as well, as we're going into the school term. We've just started school, but use the weekends, come into the city, support those local businesses, have a great day out. There's so many things to do, and also have a holiday maybe in the off season that you wouldn't have thought you would have generally done at this period of time. So we want to support our hotels, we want to support motels across New South Wales, and in addition to that, we want to support local businesses. So we'll check for you. I mean, the change we made there, James, I recall during the Delta outbreak, was because businesses were closed. And so the takeaway concept helped those businesses who had transitioned from table seating to a takeaway business, and we wanted to continue to support them during Delta. I'll speak to Victor offline about it. We'll come back to you tomorrow. But my preference is people go out and about and spend and enjoy the best restaurants, the best food and wine in our great state.
What about the $100 Friday CBD vouchers?
Yeah, well,
when are they coming online?
Shortly, and we obviously held that back because there was no point having them on when we were in lockdown. So the Minister and I announced those in the budget The budget last year. Seems like 2 years. Budget last year, and then just after the budget, as you'd be aware, we had the outbreak of the Delta variant, and we went into lockdown. We want to make sure those vouchers are available as quickly as possible to help breathe life back into the Sydney CBD. And also Parramatta. Our cities have been doing it tough for 2 years, but every single time we've come out of these challenges, confidence has increased and businesses have been back. And that's what's going to happen again. And so my key message today to everyone across our state, go out and enjoy in a COVID-safe way the best that our state has to offer. Support those businesses, those mums and dad businesses right across the state who have been doing it tough. This is the time to do it, and we can do it because of the efforts that everyone has made. And we can do it as well because we took the hard road, but the right road, to not go into lockdown, to get our kids back in the classroom, to help their educational outcomes, to help their social outcomes and mental health outcomes as well. This is the path our state and country needs to take. We've led that way here in New South Wales, but here's the opportunity. Come tomorrow, get out and about, just as you've been doing in a COVID-safe way, and support businesses across our great state. Tom.
Restrictions, February 28th, will they be eased? And given the low booster uptake, will the easing of restrictions in any way be tethered to the booster doses?
I don't want to preempt the decision making there. We've rolled those restrictions over until late Feb. Importantly, we want to make sure when we open up safely. Boosters have been key. My expectation would be, and we're at 47%, compared to other states, I have to check, James, but I think the dosage rate, the booster rate in New South Wales was behind, and there's been a strong improvement over the course of the week, and I'd like to see that increase over the next 2 weeks. So ultimately, we released information in relation to our hospitalisations and ICU in terms of what we thought the worst, middle case and best case scenario were, and it's incredibly pleasing where we sit. That does not mean our health system is not under pressure. Of course it is. Our frontline health workers have worked tirelessly over 2 years and continue to do so. They are heroes on the front line, but it's pleasing to see where we sit. We sit here today because the efforts that everyone has made to get boosted. We've rolled those over, Tom, until late Feb, 27, 28 Feb. And we'll revisit that on the way through. But based on where things are tracking, I'm very confident that we will get back to where we were. That was always going to be the case. It's the right approach. It's not taking the lockdown approach that we're seeing from the opposition and from other states. This is the right approach. It's proven to be correct, and we can now be in a position where we're looking after people's healthcare. We have downward pressure on hospitalisations, and importantly, we're opening up, getting back on with life. And I just encourage everybody across the state, keep those COVID-safe practices up, wear masks inside, keep social distancing, have activities outside as much as possible. We're seeing that across the board. This success is on everyone across our state.
Premier, just on boosters, if I go into a business now and I ask to see my vaccination certificate, it just shows the first and the second. Is it time to encourage people to get boosters is to have your vaccination certificate? It's got like a plus signal that would say, I've been boosted. In other words, businesses actually ask, have you had a booster?
Brad? Kerry?
I'm happy to answer that.
Okay. Anyone with me?
Yeah.
I've been discussing this issue with Minister Robert and my counterparts from the other states and territories, because you're right, it is an issue that we need to address. My understanding is that the National Cabinet is waiting on a target advice on the status of that third dose. Once that happens, then it will take us about 4 to 6 weeks to get essentially the machinery in place to make sure that your booster is then recognised on your app. So that's what we're waiting on at the target advice.
What would be the timeline again?
Well, we're just waiting. My understanding is, and again, it's my understanding based on discussions with our colleagues from state and territories, is that it's due any time now. But once the target says this is what our position is on the booster, i.e., it's essentially a 3-dose course, then it'll take a number of weeks, maybe a month or so, for us to then put that on the app, adopting the federal infrastructure.
But hasn't your government ruled out mandating a booster for healthcare workers, and how does that tie in with target advice and what you're waiting for?
Let's make this very clear. People should have their boosters, absolutely. Personally, I think that ATAGI should actually give the advice to the federal government so that it's uniform across the country, that there should be a cross or a tick or something to indicate that you're fully vaccinated. That's the definition. They've changed the words a few times, but having the booster is fully vaccinated at this point. It may change in the future, as we've discussed many, many times. There may be further variants come down the line, there'll be new vaccines developed, and it may be that you need to have a different way of approaching it. But right now, the emphasis should be on giving every possible message to the community that having a booster is essential. The question you've asked, though, Tom, is a different issue. That is mandating it. And what we've said, what I've said now in numerous press conferences, is that for health workers, I've consulted broadly with the health community, the doctors, the nurses, the allied health staff. I've also consulted with the fifth biggest union in the country, the Health Services Union, and the Nurses and Midwives, who represent, of course, the Nurses and Midwives Association, who represent nurses and midwives. And the view is that nurses and midwives and frontline health staff, being cleaners and doctors, they've all gone and got the first 2 doses, and they are going about getting the boosters. But from the point of view of they're all tired, they're exhausted, obviously, from the point of view of the work they've been doing for 2 years. And the view is allow a more nuanced encouragement at this point rather than actually making it mandatory. I've said numerous times in these press conferences that that's something that we've got constantly under review, but right now that's the approach that we're taking. Sorry, James. We value our health workers. We value the people that have been at the front line, as the Premier and I have said, and my colleagues have said, as Dr. Chant said many times. And if it is that they are suffering the exhaustion, which we all know they are, then we'll work with them for the time being. But, you know, the rules may change at some point. James.
I don't quite understand. You said that the target should make the definition of fully vaccinated to be 3 doses.
Yeah.
So you need 3 doses to be fully vaccinated.
They've said. Look, I'll get Dr. Chant. James, I'll get Dr.
Need to be fully vaccinated according to your.
Say that again.
You're not mandating a 3rd dose for nurses.
The two things are not connected, James. You're trying to connect them. They're not. But in terms of all of us, sorry, James, in terms of all of us, we need to go and get the boosters. Pretty simple. Pretty simple. Get the booster. But if you do, what I'm saying is I think it would be good if ATAGI would give that advice, that we could have it nationally across the board, the tick or something on there to show the 3rd dose has been given. That's an issue for those people who want to ensure that when you're having someone come into your home or to your restaurant or your cafe, that people have been fully vaccinated. It also reminds people, I think, that the importance of getting the booster. That's my view as the Health Minister here in New South Wales. But there's a different issue, which is should we be mandating the health workers? And at the moment, as I've said now, I don't know how many times, that's not on our agenda at the moment, because we have listened to the health workers, we've listened to the unions, and we're trying to gently and a gentle and nuanced approach to make sure that we take people with us, which is largely what we're doing with the broader community. Although, as the motto now says, and the new campaign, let's do this. Let's get on with it. Let's do this. Yes, James.
Just briefly on another matter.
I'll come back for your cross-examination shortly, James. Yes.
There's been some concerns raised about the deaths of 2 inmates at the Sydney private correctional facility.
Yes.
It's understood perhaps that one of them did have coronavirus. David Shoebridge says that there's a bit too much secrecy around medical care for prisoners. He's calling for some sort of investigation. Firstly, what do you make of those deaths, and would you agree?
Look, anybody's death is a sad occasion, and on this occasion, I've actually spoken to a number of people this morning about that when I saw David Shoebridge's comments. And there's a full investigation going on at the moment, instituted by the government corrections health, forensic health, and hopefully that will give some insights into what has actually occurred. But what I do understand is that we've had 2 people pass away, one gentleman in his 30s and another person in the 40s, and we're looking to find out exactly what has occurred, but I can't give any more information at this point. Yeah. James, more questions?
Yeah, I don't quite understand. If fully vaccinated means 3 doses,
yep.
Won't healthcare staff then need to have 3 doses because they need to be fully vaccinated to work now?
But it's not mandatory, James. That's the difference.
But if fully vaccinated is 3 doses.
Yeah.
They'll need 3 doses if they're perfectly fully vaccinated.
Yes, and that's what we're trying to achieve through a nuanced and gentle approach to people who have actually had a very rough 2 years. And as I said, if the government needs to change that position, just like we have all the way along the line, we will. But as I said on, I think Friday was the last time I said it in detail, and that is we've discussed it with the head of the Nurses and Midwives Association, Brett Holmes. We've discussed it with Gerard Hayes from the HSU. Gerard Hayes actually was quoted in The Guardian, for those of you who want to know about one print, and actually backed in the government's position and noted that that was the advice. So it's all out there already done, James. Any other questions for me, or will I hand over to someone else? Tom.
If the ATAGI advice comes back, suggests 3 doses to be fully vaccinated,
Yep.
would the government reconsider its position and impose mandatory 3rd dose?
As I've said, we will constantly be revisiting everything. And for 2 years we've revisited everything. But at the moment, where we're very keen to be, is to thank our health workers, thank the frontline staff who've put themselves at risk through this last 2 years to keep us all safe. They're tired, they're exhausted, and it's just a respectful way of working with our frontline health staff. If it needs to change at some point, then there'll be discussions with the entire sector, the private hospital sector, the private medical sector, the public sector, the unions, and we will have that as an outcome that we'll all agree on. But at this stage, I think I've made it pretty clear what our position is. Thank you.
Premier, just on boosters, I mean, we're here today talking about a relatively low uptake of them and a need to increase it. What type of example does this set from your government that you're not even mandating it for healthcare workers?
As the Minister has said, we will continue to revisit this and look at it. Ultimately, we haven't even received that advice from ATAGI yet in respect of the 3rd dose to be fully vaccinated. So what we're saying, as we're seeing across the country, is boosters work. Boosters keep you safe. That's a very clear... We've been driving this message over the course of this entire period. We're not... we haven't... We achieved, in the main, a 95% vaccination rate. Yes, we mandated that vaccination in certain high-risk areas. Now, we'll wait on the ATAGI advice and we will always adjust our settings, as we have during the entire pandemic. But this government cannot be more clear in relation to what works. And what works are booster shots. What works is vaccination. That has been key to New South Wales being able to open up safely. We have been in a very strong position here in our state. I know we want to focus on negativity a lot. Let's put some positivity into the story here. We have one of the lowest death rates anywhere in the world. We have the strongest health system here in New South Wales in the country by a country mile, and one of the best health systems in the world. And that's ensured that whilst under pressure, our health system here in our state has stood incredibly strong. Our economy here in New South Wales remains strong. Our foundations fiscally and economically are strong as well, and that's enabled us to put programs together like the one that we're announcing today, to put money in the hands of families right across the state to go out and support our businesses. We are in this strong position because of the efforts that everyone has made. As the Health Minister has said, we accept people are tired. This pandemic has gone for 2 years. Now, we want to wish it away if we could. But the reality is, we remain in this pandemic. Other curveballs and challenges will come our way as we move through. We don't know what lies ahead. And so therefore, the best thing that we can do is get boosted. But what I do know is that our people have stood strong for 2 years, that our economy has bounced back twice, and we will come out of this stronger out the other side, just like we've done over the last 2 years. Vaccination is key. Boosters are important, as we know. We're launching this campaign. Please go and make that appointment. If you've got an appointment in a month or so, just come to one of our centres. Get it done. It's incredibly easy. You're in and out. We've got the best health workers enthusiastically here, helping out and making sure that we look after people who come through. I know we've asked a lot. We've made difficult decisions over 2 years. It hasn't been easy here in our state, nor has it been easy anywhere else in the world. But we have a lot to be proud of. We have a lot to be proud of. We're in a very strong position now. These vouchers are around tomorrow. Please register for them, and please go out and enjoy the best that our state has to offer. James?
The new Emerald Mark II class ferries have been offline on weekends for us as well. When are they going to start doing the job that you want them to do?
I'll find out when you come back.
Just on tourism, international tourists potentially coming back sooner than later. What do you think about that? And also, secondly to that, cruise ships. Do you reckon we'll see them in our harbour anytime soon?
Well, on tourism and international tourists, it's incredibly important. We led the country here in New South Wales in abolishing hotel quarantine for those who are vaccinated, fully vaccinated, and we want tourism to come back. That's just not important for small businesses, mums and dad businesses right across our state. But it's also important for labour shortages. The biggest challenge, what's very pleasing, and I feel for the Prime Minister, who didn't get much of a run the other day when he spoke about having an unemployment rate with a 3 in front of it. That's a great result for this state. But in addition to that, we know that many businesses right across the state are crying out for staff. The best thing we can do in relation to that is open up our borders. So that's our approach that we completely support in New South Wales. And we know that's going to support businesses right across the state. In relation to cruise ships, well, firstly, that's predominantly a matter for the federal government. We'll work through those issues as we move through this next period of time. But what I want to see in our state, as I've seen over the last 2 years, is confidence returning, and confidence has returned. It's coming back now. It's pleasing to see. Anecdotally, speaking to small businesses, speaking to cafe owners, restaurateurs over this period of time, they're feeling more confident. And that's because our people have gone out, been vaccinated, been boosted, and now are going out and about. That's a great thing for our state. It's a sign of success, and that is testament to the efforts that people have made across New South Wales. We've just got to keep making them. I know, and that whether that's getting boosted, whether that's the isolation requirements that are still in place if you test positive for COVID. I know that's a challenge for many parents at the moment, but I tell you what, it's a much better result. It's a much better outcome than what other people were calling for in terms of closing down schools, because then every kid would be at home, every child would be at home across our state, not having face-to-face learning. We've been able to not close one school like we had to in certain circumstances post a Delta outbreak last year. We should be very proud of what we've achieved here together as a state, and I'm very confident as we move through this period, if we all go out and get that booster shot, that there are strong signs that lie ahead for the people of New South Wales.
Thanks, everyone.
Thanks.
Thank you.
Are you